I think we can get started with Dr. Jarvis. The floor is yours.
Good afternoon, and thank you for joining us. As usual, Paul and I are doing good social distancing, and our entire crew are wearing face masks, but we're going to take our face masks off in order to improve sound quality for the video. So, good hand washing and hygiene as well. Putting on our sanitizing fluid. It's no longer hand gel. So I'll start off with a few updates. First and foremost, we're going to give out some numbers here. Currently, there are 15 COVID positive patients that Northern Light Health is taking care of. One of them is at Northern Light Eastern Maine Medical Center. 4 of them are at home under the care of our home care and hospice, and 10 are at Mercy Hospital. That is now the highest number that Mercy Hospital has had since this pandemic has begun. We do have 10 additional people across our system who are persons under investigation, meaning we are just awaiting test results. And to date, Northern Light Lab has tested 8,301 individuals, with 223 of those individuals being positive. We've been keeping you up to date as far as our expansion of COVID-19 testing and the guidelines that we use for testing. We recently made some additional updates that I want to share with you. As of yesterday, May 26th, we were able to expand our testing capability, which was actually moved up from, I think, the briefing that I had given you last week. We are now able to test all individuals who are undergoing elective or operative procedures that are aerosol generating, and any other procedure where a test result may result in less usage of personal protective equipment. We've also been able to expand out to test those Tier 2 individuals who are symptomatic. Those would be the individuals who are over the age of 60 or suffer from chronic medical conditions, particularly those that cause you to be immunosuppressed. With all things, these do require an order from a provider, and we are asking that for those Tier 2 individuals that there be some kind of assessment by that provider prior to sending them for testing to ensure that the test result will change the clinical outcome or have an effect on that clinical outcome. We're also expecting that by June 15th, we should be able to also expand out testing even further to include in all of our inpatients across our system, as well as those individuals who do not meet Tier 1 or Tier 2 categories, but are symptomatic, and we're hopeful that we will be able to accomplish that. As we've been seeing across the state, there has been an increase in the number of COVID positive cases, particularly in Cumberland County, and as I said, Mercy Hospital has now seen the highest number of inpatients that are infected with COVID since the pandemic began. But we did want to talk about what this means as we go forward, as we see a reopening across our state. We know there are lots of questions about when will we get back to normal and how will we be changing as we go along. We continue to increase our capacity at our hospitals and introduce some of the procedures and necessary office visits that we have seen before. We want to assure that we are doing so in a safe and effective manner. We have stepped up our screening process at all of our entranceways. We are requiring that individuals who seek care at a Northern Light facility come in with a face covering, and that if patients do not have a face covering, we will provide a mask for them during their visit. We continue to restrict visitation, and each facility you should reach out to determine what they have for visitation, whether that be at one of our acute care hospitals or one of our nursing facilities. And we will continue to ask screening questions of individuals as they come into the building, so we can further assess where it is appropriate for them to seek care. And so those will continue. There are definitely some concerns out there as we see that increase in number of cases, particularly in Cumberland County. We're not sure if this is just a continuation of our initial surge or if this is the result of the fact that we are reopening various parts of our economy, and we will continue to monitor that situation. We are concerned about how things will go through the summer and particularly into the fall as we head into influenza season, and we are prepared for that. Some of the lessons that we learned in the early part of this pandemic we will continue to use as preparation for any future pandemic or any other catastrophic need that Northern Light can respond to. We do know a whole lot more now than we did when this started, and we have used that information to both treat and care for patients in our communities, and will continue to do so. And with that, I'll turn it over to Paul for a few comments.
Thanks, Dr. Jarvis. And just to elaborate on some of the points that Dr. Jarvis made with regard to providing care and seeking care when needed. We had about a 50% decline in our general patient volume during the height of the initial COVID pandemic. We're about at 70% or so right now, and continuing to increase appropriately, where providers and patients are working together to determine what's their right approach for them, whether it's telehealth, whether it's to come in for an office visit for needed procedures, et cetera. And so I would encourage anyone who has up to this point delayed care to work directly with their provider to determine what's best for them in their circumstance. And we continue to be open and providing care on an as-needed basis to our patients. And so we're here for that. So continue to work with your provider directly, and that's the approach.
And we just want to take this opportunity to once again state that we need to protect each other and look out for all the members of the community. So please continue to do good hand washing, using hand sanitizer when hand washing is not available. Remain socially distant from other individuals when we're out in the community. And please wear face coverings. Face covering is an added protective effect of social distancing, and both of those need to be used in conjunction, particularly to protect our most vulnerable people, those people that are over the age of 60, those with chronic illnesses, children, and then those that we just need to be out in our community, like our first responders, our police officers, our ambulance crews, our fire department, our military, and our healthcare workers. And so we thank you, members of our community, for supporting us as we support you. And with that, we'll open it up for questions.
Okay, as Dr. Jarvis mentioned, it's time for questions. I'll call on each media organization and unmute you. A chance to answer 2 questions. The order that we'll go in today will be WABI, Bangor Daily News, Mascot Bay Press, TV7, WERU, and Maine Public. You can direct your question to either Paul or Dr. Jarvis, or if you don't, whoever the best person is to answer will pick it up. So with that, we'll start with WABI.
Hi there, thank you. My name is Spencer Roberts. I was just hoping you could talk a little bit more about those who've been waiting to seek care for non-emergency problems. I know you guys addressed this a little bit, but kind of the best approach for people who are kind of uncertain about how to approach problems that are non-emergency.
Great, so that question, thank you, Spencer. So the question was, how are we reaching out to individuals, and how can people be sure that if they have been delaying care, how do they get in touch with us? And so our office numbers are still available and open, and so calling directly to your primary care provider or to the specialist that you might have been dealing with is the best and most effective way. We have been trying to reach out to particular individuals, those that we know have been waiting, particularly for those time-sensitive tests, so things that we knew we could delay initially during this pandemic, but that we wait any further that they may cause harm to the patients, and so we have been actively trying to reach out to them. If you are expecting a call and had not had one, please reach out to any of our facilities, and we'll be happy to discuss that and help you through that. I will remind individuals that we continue to expand out our telehealth program, and many of our patients have found that to be a very worthwhile and rewarding experience, that they can stay at home and still reach out to their provider and have a conversation and assess care. And so we encourage you to do that as well, working with your providers where that is appropriate. And then again, we are trying to do everything we can to safely reopen, and so that we are here and that you can feel comfortable and safe as you seek care with us. Thank you.
Thank you. That's the only question I had. The other ones I had were answered adequately during the briefing. Thank you.
Thank you, Spencer.
Okay, great. Now we'll move on to Bangor Daily News. Charlie, you're up.
Yeah. Hi. I guess this question is for Dr. Jarvis. Thank you for having this hearing as always. Can you speak to where things stand with Northern Lights' ability to kind of stock up on some of the supplies that were initially very hard to get, like testing swabs and testing transport via PPE? Like, have the hospitals been building up a supply of that, and do you expect that to last for a while, or do you think there could be challenges in the medium term to, get more of that if there's another or a continuing surge?
Thanks, Charlie. So the question was, where are we at with our supply chain? We know that we spoke very frequently in the beginning of this pandemic, about challenges that we had with supply chain, particularly in key areas like personal protective equipment, those testing swabs for us to be able to perform tests, and the transport media that we transport a swab to the lab in. I'm happy to say that right now we feel very comfortable with our supplies in those areas. Again, like we've been doing all along, we monitor that on a daily basis. We actually look out to see what we have on hand. We look at what our current usage rate is, and then predict how that will affect us over a period of time. And then we calculate out if we had to increase that particular, what we call a burn rate, by 2 or 4, and where we will be. And right now we feel very comfortable both with our personal protective equipment supplies and with those valuable testing supplies. But it is a challenge, it is a concern for us. We continue to work with our partners both at the state level, the federal level, and then with private enterprises in order to make sure that we have those adequate supplies to continue to take care of you, our patients. As you can see, we feel comfortable with our testing supplies in particular as we have expanded testing criteria out both this week and then anticipate over the next few weeks that we will expand that even further. So thank you for that question. We will see how things go, and we are hopeful that the supply chain will get back to its normal level as the summer months go on, and we've seen that on a pretty steady level, so that's good news for us.
Thank you. And then my second question would be maybe either for Dr. Jarvis or Paul, whoever wants to take it. With the kind of lost or down revenue from a lot of services being delayed and postponed, do you have any knowledge or thoughts at this point of how big picture that could affect Northern Lights system-wide operations, like whether any locations or services may have to be scaled back or anything?
I'm going to hand that one off to Paul, and then we can come back to me if I need to.
Thanks, Dr. Jarvis. So the question is, do we know yet or have a prediction on what the dip in our patient volume over the past few months is going to have in terms of long-term impact? It really is too early to know for sure. We have seen some hospitals around the country, some health systems around the country returning to some level slightly below normal in terms of their recovery. We're in a rural state such as ours and the broad breadth of services that we provide throughout the state, we really don't know for sure. We're planning to appropriate cost controls, but the focus really is providing care for patients today and being prepared to provide that care in the volumes that we expect tomorrow and in the days to come. And so I said, earlier, we're about 70% in terms of total volume from where we were prior to COVID, and we're seeing that increasing, on a regular basis over each day. And in fact, some of our member organizations are further down that path to normal volume beyond the 70%. So it really is too early to tell in terms of long term, but we know that it's important that we're able to provide the care that our communities expect of us, and it's important for our community members to seek the care when it's appropriate. So it goes back to my original point of ensuring that that patients work with their providers to determine the best protocol for them.
All right, next we have Leslie Landergan, Comstock Free Press. Do you have a question today, Leslie?
I do. I'm really sorry I missed the first few minutes of this, but I take it that you're expanding testing a lot. And I'm curious, I understand that the testing stations, or whatever you call them, in Castine and Stonington stopped testing basically for lack of volume. And I'm wondering, are you going to be starting up testing there again?
So we don't have any current plans to do that. We did make sure that that every one of our Northern Light facilities has the ability to do testing in a particular location. You are correct that some of our testing sites we did step down simply because the volume didn't warrant us continuing to have an outside drive-up location, but all of our acute care facilities do have the ability to do testing if necessary, and so patients can seek out that. As we do not feel that that's going to be impeded in any way by the increased volume by expanding out our testing. And if we do need to stand up another drive-up testing facility, we will do that.
So in other words, if I were to go to a clinic in Castine and I was showing symptoms of flu or COVID, they would be able to test me there?
They might not be able to test you at that particular facility, but they could certainly direct you to one that would be. And if you call our triage line, if any patient called our triage line, part of the process is to find out where individuals live and to get them to the closest facility that could do the swab or testing for them. And so we have continued to do that, and we may even recommend going outside of Northern Light if that works out to the advantage of our patients.
Thank you.
You're welcome. Thank you.
All right, next up we have ABC7 Fox 22. TJ, the floor is yours.
Good afternoon, thank you. Mr. Boland, I'm assuming that retirements and people moving on to other jobs hasn't stopped because of this pandemic. So what my question is, are you having any trouble filling any vacancies that are critical to providing the service to the public?
So the question is, were we having trouble filling any critical vacancies to providing care? We're still seeing a fairly steady volume of applications for providers, nurses, techs, and other support and clerical staff throughout the system. So we're not seeing a big downturn in that. Certainly there's enough awareness of healthcare as an opportunity for employment that we think that that's continuing that high volume of interest and employment with us. In addition to folks who are motivated to seek a career in healthcare, which may have been spurred by COVID and seeing some of the responses nationally in the healthcare setting. So at this point, we're not seeing a significant downtick in our interest in employment with us.
And this next question may be for Dr. Jarvis. Are we in a different stage as far as medical services go than the state is as far as their reopenings go? And are those stages dictated by the federal CDC?
So the question is looking at the stages for what has been called reopening. So I'll clarify that our hospitals have been open the whole time, as has been our practices. Just obviously we've limited the number of individuals that we have been seeing. And do we follow the same kind of guidance that we do for opening up the rest of the economy? And so they do follow in parallel. It has certainly accelerated a little bit in healthcare because, as we talked about for the last few weeks, needing to make sure that we get those time-sensitive visits and procedures accomplished, the things that we delayed initially, but felt that the longer we delayed could have adverse outcomes for our patients, and we certainly do not want to see that. We do have guidance from both the federal CDC as well as the state of Maine CDC and other healthcare agencies. This is a healthcare epidemic. And therefore, healthcare agencies certainly have been providing advice. We follow the advice of the American College of Surgeons, the advice of the American Medical Association, and various other associations and colleges that are involved in healthcare. We review those on an almost daily basis, if not every day, and make sure that we are following that good guidance and doing things in the manner that adheres to that, but also meets the needs of our community. So thank you for that question.
If I could, with just one final one. We've talked about when the pandemic started and when things started in Maine. If you had to say, are we where we are now with the pandemic? Are we in the middle? Is there a light at the end of the tunnel? Where would you say we are along that timeline?
So the question is where do I think that we are along that timeline? And I certainly don't have the crystal ball no more than anybody else does. I will say that some of the predictive models that we scoffed at initially by saying that they seem to be stretching things out way too far may actually turn out to be the ones that were most correct. 2 weeks ago, we were saying that Maine looked like it was on the downturn, being one of the first states that were able to reopen based on guidance, and yet now over the last 5 or 6 days, we have seen an increase in the number of cases. So it may be that unfortunately the worst may be yet to come, and that's why it's imperative that we continue to do all of those good things to protect ourselves, our loved ones in our community, washing our hands, staying socially distant, wearing the face covering, staying at home when necessary, when it's not necessary to go out. Sorry about that. And then again, if we look at past pandemics, while we have never had one that we are aware of that involved a coronavirus like COVID-19, we have seen significant epidemics and pandemics from influenza, and they tend to have a second surge, and it tends to be during that fall-winter months for the United States. And so that coincides again with our influenza season. So if we had the double whammy of a bad influenza season coupled with a rise in COVID-19, that could have devastating consequences for us. We want to prevent that, and the only way we can prevent that is by all of us acting together. Until a adequate and useful vaccine is developed, the best things that we have to do to protect ourselves are the things that we've been doing all along. Maine has done an excellent job. That's why our curve has been low, but we want to keep doing that excellent job so that we do not see those numbers other states have seen. Thank you.
Okay, next up we have WERU, Amy Brown.
Thank you. My first question is for you, Dr. Jarvis, and just building on what you were just talking about, what do you do to prepare for a possible surge, or probably a likely surge during flu season? Are you stocking up on PPE? Are you scheduling procedures, elective procedures, so that they won't fall during those months? Are there any other steps that are being taken to prepare for that?
So the question was, how are we preparing for either a second surge or just an increased number short term? We are trying to do the things that you suggest, particularly in trying to make sure that we replenish our preparedness supply of personal protective equipment. That is difficult because we are currently using that equipment on a daily basis in order to protect our staff as well as our patients and visitors. But that is part of our preparedness plan. More importantly is building on the relationships that we have built throughout this pandemic here in the state of Maine. I speak frequently with my counterparts at the other 3 large health systems. We talk nearly daily with members of the CDC here in the state, and we have coordinated care across our smaller hospitals in conjunction with our large medical centers. So here in Bangor, Northern Light Eastern Maine Medical Center speaks very frequently with St. Joseph's Hospital and Penobscot Community Health Centers, so that we are in alignment with one another, that we are sharing the best information we know about this virus and how we can take care of the people in and the members of our community. And I think that's the single best thing that we will learn from this, is that we need to work together. We can't see each other as competition anymore. We are in this together, and we will get out of this together. In addition to that, we have beefed up the way that we communicate so that we can get invaluable information to our providers so that they have the best, most current knowledge at the time that they're seeing patients that may have this. And then working again with our partners to make sure that if we needed to stand down procedures like we did at the beginning of this, if we needed to limit the number of visits to our facilities, that we are prepared to do that. We won't have to ramp up with telehealth. We are using telehealth, and we expect that we will continue to use telehealth as a means for providing adequate care to the patients that need it. And so all of those things are how we're monitoring ourselves and being prepared for whatever comes next, whether that be a second surge of this, another infectious disease, or another tragic accident on I-95. We will be prepared for that. Thank you.
Thank you. And Mr. Boland, I think this question is for you. Can you give a count of how many Northern Light employees have tested positive, and if you have it, sort of a breakdown of maybe a rough percentage of how many of them are direct care workers versus working in other areas of the Northern Light?
Sure. So the question is, how many employees have tested positive? Off the top of my head, I'm not sure the full number. I know we've had 2 work-related exposures that resulted in a positive COVID test, and that has been that number for several weeks now. It was a coworker to coworker transmission.
But you have more than that, people testing positive though, right?
We've had more over time. Dr. Jarvis, do you know the number?
I don't know the exact number, but we have been done good contact tracing, and as Paul said, we've only been able to identify 2 individuals who contracted COVID-19 from a workplace exposure. Most of the others have been community spread. And that's really what we've seen around the country too. As data comes in, healthcare workers tend to actually have a lower prevalence of COVID-19 than the general communities that they live in. And that's because of a couple of factors. First, we recognize the need for wearing personal protective equipment very early on, and we're trained on how to put it on and off. We tend to also, when we're out in the community, practice good social distancing and wearing our face coverings so that we can be both examples to the community and also to protect ourselves and our families. And if you follow our example, you'll see that, that the rates will go down. Thank you.
And last but not least today, we have Maine Public. Patty White.
Hi, thanks a lot. My questions are for Dr. Jarvis, I think. I just wanted to make sure I understand your testing capacity. So you were saying that you're able to expand capacity over the next couple of weeks, but it sounds like you still will be able to test everyone who's symptomatic. Am I understanding that correctly?
So currently, no, we cannot, unfortunately, test everyone who's symptomatic, but we have expanded out. Initially, we were only testing people in that Tier 1 category, so that was individuals who needed to be hospitalized for symptoms suggestive of COVID-19, healthcare workers and first responders, and those living in congregate living situations. We've now been able to expand that testing to Tier 2 individuals, which would be that category of high risk, which is people over the age of 60 and those with chronic medical conditions, particularly heart disease, diabetes, and cancer. And then more importantly for the reopening or the expanded capabilities at our hospitals is being able to test those individuals who will be undergoing procedures that may cause aerosolization of the particles that unfortunately carry the virus. And while I say that's important, it's because it allows us to conserve some of our personal protective equipment so that we have it in case of a larger surge. We hope that by the middle of June we will have acquired yet another analyzer, and it will be a high capacity analyzer, and that will allow us to test more individuals, including all individuals who are symptomatic and those who are admitted to the hospital even if they do not have symptoms of COVID-19, in order to make sure that we are using the best and most effective protective equipment for those individuals as well. So it is a staged process. It all hinders on making sure that we have those testing capabilities, meaning that we have those nasal swabs, that we have the reagent that we need to run the machine, and we have the media to transport the swab from a collection site to the lab. We do know that new technologies are being developed, and we continue to follow that and have added some of those new technologies to, again, further expand out testing. In addition to that, the state of Maine has increased its ability to test as well, which has made it so that we can offload some of the testing that was happening at long-term care facilities, for instance, and so that preserves our testing capabilities for us to be able to expand into additional categories. As the state overall increases its ability to test, it will just be a benefit to all of us, and we'll be able to continue to expand that. But it will be in a phased-in approach. And I think that's the most appropriate thing. The last thing we want to do is test people unnecessarily and then wind up not having that supply for when we need it. So we will continue to be judicious about our use, but making sure that those who will benefit the most will be tested. Thank you.
Okay, I understand. Okay, that's great. And then actually one other question, with the state, the reopening plan where there's the next stage is next week. I'm just curious for your take on it, just from the health perspective. Is there anything that you're hoping in the plan? Are you hoping that anything will be adjusted, in terms of reopening? I don't know if you have any concerns with the number of cases increasing. If you'd like to see anything change with that.
Yeah, so the question is, do I have any concerns with as we reopen various parts of our economy? To be blunt, I'm paid to be the person being concerned about those things. And so sometimes my coworkers will say I always sound like the downer person, but that's what my job is right now. My job is to look for every opportunity we can to protect the most lives that we can. And so I am concerned about it, especially as we start seeing more and more people gather in places and not following the guidance that we're giving them. If we all continue to practice good social distancing and wearing face coverings while we were out in public, the sooner we will be able to safely open up more and more avenues of our economy. For those individuals who say, I don't want to wear a face covering because, for whatever that reason may be, but they still want to be able to go to a movie theater or go to their local restaurant, that's the reason why you have to wear that face covering. We have to protect the employees that work at those places as well as the patrons that visit them. Same thing with lodging, same thing with our campgrounds, same thing with our state parks. All of those things can reopen sooner if we all do the things that will help protect us all. And so that's what I'm asking for your viewership, your readership, your listenership to understand. I would prefer not to have to wear a face covering all the time. I wear a mask long enough during the day at my job, but I will continue to wear one until we come out the other side of this, because it's important to me to protect my family, my community, my friends, and my fellow Mainers, and I wish that we all do the same, and thank you for that.
All right, well, we're at 1:30, so let's wrap things up for today. I will send a link to the Dropbox folder that will have the clean video file as soon as it's ready this afternoon. And I thank you all for attending, and see you again next week.
Thank you.
Thank you.